Hi, and welcome to DC Health. What I'm going to show you is a sample core conditioning injury prevention program that we'll often use with our clients. The workout's designed for exercises performed in a circuit format with about a half-minute rest in between exercises. The key thing with core conditioning and injury rehab is if at any time your form stops, discontinue the exercise and take a break. We really want to emphasize correct form. The first exercise we're going to do is called Lower Abdominal Coordination Level 1. This will be in the program, but it's on the link just above this video. To perform this exercise, lay down on your back and slide one hand underneath your lumbar spine. What you're going to do is use your hand to maintain a position of neutral spine. So if you lose the position, what will happen is the spine will actually pop off the hand, it will lose pressure. So you lay down, from here take a big breath in. As you breathe out, draw the belly button in and brace the core. What I like to do is put one hand in the belly button just to make sure it stays in. From here, simply lift the leg up and down while maintaining that spinal position. The left hand should feel what the spine's doing. What will happen if you do it incorrectly is pressure will actually come off the hand and the spine will raise up. So you want to maintain that hand. Do this exercise, do about 10 repetitions per leg at a nice moderate tempo. What this exercise does is it trains the hip flexors and the legs to work in conjunction with the core. So it's really important for rehabilitating low back injuries. The next exercise we're going to look at is called the bird dog. This exercise trains the multifidus muscles, which are important stabilizers of the spine, and integrates the core with the upper and lower extremities. To perform the exercise, what you do is get down onto all fours. Knees directly underneath hips, hands underneath shoulders, spine in neutral. A neutral curve is basically not rounded and not arched, somewhere in between. From here, breathe in, draw the belly button in and brace your core, kick out with one leg without rotating the spine and reach up with the opposite arm. Hold for 5 seconds and bring back. It's really important when you're doing this exercise to not lose the core stability and actually rotate the body. One of the true functions of the core is to prevent rotation. So to recap, breathe in, breathe out, draw in the belly button, brace the core, push out with opposite leg, opposite arm, hold for 5 seconds, come back, swap. Prescribed repetitions are about 10 each side. The next exercise we're going to be looking at doing is called the side bridge. This exercise has a very high correlation with low back pain. Basically, if you can't do this exercise well, there's a high chance you're going to have a low back injury at some stage. To perform the exercise, two versions. You can lay on your side, elbow directly underneath your shoulder, body in a straight line on the knees. From here, lift the hips up and hold. The more advanced version is to actually go from the feet. So legs go all the way out, draw the core in, draw the belly button in, brace the core, and up we go. Your goal initially is to hold for 30 seconds. Our end goal is to hold for 45 seconds on both sides without a problem. Simply swap sides and make sure you do the other side as well. Okay. And the last exercise we're going to do is an oldie, but it's a very good exercise. It's called the plank. It's an excellent exercise for training the anterior core musculature and preventing movement at the lumbar spine. To perform the exercise, two versions. Simply get your elbows and forearms on the ground, knees on the ground, lift your hips up, feet on the ground, activate your core by drawing in and squeeze the glutes. That just helps give the sacroiliac joint that little bit more stability. To progress the exercise, up onto your feet. The most common error seen with this exercise is rounding of the back. That's training the rectus abdominis muscle, not the spinal stabilizers we want. This program can be performed anywhere from 3 to 5 times a week as part of an injury prevention and injury rehabilitation program. Thanks for watching.